In the previous video, um, I talked about optometry school. Um, in some ways, it could be a pre-med, but usually once you achieved or once you obtained a license that affirms you that you are a doctor of optometry, well, it it wouldn't be that necessary for some people to have to go to med school or yeah usually your choice is ophthalmology if you choose med school afterwards. But aside from optometry, I've also seen an alternative career. Um, Basically, you work under the supervision of a doctor, but you technically do the same things as a doctor. Um, Usually, it is recognized that PAs or physician assistants work the same hours as doctors, but they're paid less. But on the bright side, you study less compared to um, doctors. Um, so I believe, if I remember correctly, PAs study 4 years of bachelor's and an extra 2 years. Um, I'm not sure if you call it masters, but basically in those 2 years, you specialize in um, being a PA. And after that, well, the the competition is really high. It's difficult to find someone who would accept you after those 2 years. But yeah, it's the survival of the fittest, basically. Um, so before we proceed, sorry, with after without further ado, basically, um, let's start. So, a physician assistant, in other words, physician associate, they examine, diagnose, and treat patients, and they work with other professionals. So, this is the salary comparison. In the Philippines, it's well, I'm not sure if PAs are even a thing here in the Philippines. Um, I tried researching as much. Uh, I tried researching really, and usually the most famous occupations are physicians, nurses, uh, PTs, radiologists. Uh, yeah, those kind of people. Um, Although maybe physician assistants also exist in the Philippines, um, but they're not that popular. I think that is the implication. Um, so the salary is almost 15K. In the States, it's 121,530. In Canada, it's 61K. Japan, 105K. Norway, 44K. So what is the education that's needed? A master's degree. Um, this is probably the extra 2 years that you study after your bachelor's. Projected jobs, 40,100 compared to uh, compared to optometry. Um, Job prospect for physician assistant is relatively high. Um, this basically means that there could be great demand, so it could be wise to consider PA as one of your choices on what to pursue in the future. Whether right now you're a high school student, um, like I used to be 2 years ago when I was researching on this, whether you're in college right now, um, you're in a pre-med course, um, it is wise to consider PA school. So, what are high-paying PA jobs? So, in the States, um, there are three. ER, if you work in the ER, if you are an emergency medicine physician assistant, well, these two are not so different from each other. One is ER, one is EM. Uh, and we have primary care. Usually, this is the calmest compared to the other two because, of course, um, in emergency medicine, you have to think fast. time is always of the essence. So every move matters. Every second matters. Usually, you minimize the amount of mistakes that you make while trying to treat the patient who is in critical condition. So usually in primary care, you're usually the jack of all trades. I admit I'm not sure what I just said, but I think it means that basically what I want to say is you um you treat a broad classification of people. So yeah, but you don't specialize in a certain field. Like just like in primary care, um, say you're in internal medicine or you are in family medicine, you treat everyone. In internal medicine, regardless of age, you treat everyone. But for family medicine, I believe you also include children. So yeah, if the certain disease is more complicated, usually you refer that patient to a more specialized physician, say cardiology, um, neurology, orthopedics, so stuff like that. Um, so, what are the best undergraduate degree fields for PA? So we have, well, undergraduate. This means pre-PA course. If med school has a pre-med that you have to take before pursuing med, PA has a pre-PA course that you have to take first. So what are good choices? You major in biology, major in chemistry, biochemistry, psychology, microbiology, any of the five. Any of the five areas. In the Philippines, usually the best pre-med courses are, well, let me write it: nursing, physical therapy, medical technology. I'm not sure. I tried researching if medtech was also um, common as a pre-med in the US. Usually, the most the more popular option is BS Bio, but this course is pretty controversial. Um, I've seen how certain people said that usually it's not a good fallback option, because if you didn't want to pursue med school anymore, then finding work with just a BS Bio degree wouldn't cut it. Usually, after graduating BS Bio, you take masters and, if possible, even a PhD to um, find you a job somewhere more easily. It's a different story, just to let you know, for engineering. This is actually the reason why I didn't choose BS Bio anymore. I didn't continue. I did. I was given the chance to pursue BS Biology in Ateneo de Manila University, but because of the reason that I've just stated, um, if I wanted uh, to pursue other things, it would be difficult because there's it's not really safe to be in BS Bio when you're not pursuing medicine anymore. And on top of that, one of the struggles of not just me, um, it's also a struggle for many international, well, students who are not in the States, who have a different nationality, such as me. So I wanted to pursue med school in the States, but the States is very clear that if you wanted to pursue med school in the States, to pursue med school there, you would have to graduate pre-med there, not anywhere else in the world, even though um, it's already pretty prestigious to be offered BS Biology in um, one of the top universities in the Philippines. I wasn't willing to risk um, being rejected even after graduating from Ateneo. It was too risky. It was still safer for me to start college in the United States. So, yeah. Well, yeah. Um, I eventually decided that I'd go chemical engineering. Out of all the engineering courses, um, together with biomedical engineering, usually these two are the closest, the most likely that would give you a chance in med school, even if you're in engineering. Other engineering courses, usually they're not good pre-meds. They don't give you a decent foundation on chemistry um, and biology. Biology is what is usually majored in biomedical engineering. Although in chemical, maybe there's not much bio, but there's a lot of chemistry that could be useful. Um, so yeah, probably after pursuing chemical engineering here at De La Salle University, I would proceed to um, I would try to find work in the States, and I guess that's it. The salary isn't that bad either. Um, it's challenging work. Um, it's gonna be challenging the next 4 years of my life, but well, it's either this or I'm supposed to be in the States by now. Uh, Having enrolled in a pre-med course already. But that's not, it can't happen right now. Anyways, yeah, going back. So what are classes to consider taking as an undergrad? So we have anatomy and physiology, biology, chemistry, math, statistics. This could be important for making research papers. You know what scales to use to measure certain data. Um, it's very useful, basically. We have microbiology, medical terminologies, healthcare ethics, and psychology. Even if you're not taking law, you need to know about ethics. Um, you need to be aware. It's not just all med stuff. You need to know something about laws related to your profession. So PAs generally obtain a bachelor's degree and a master's degree. Everyone, all PAs, must complete an accredited PA course through a graduate program. So what's the result? Well, you get a master's degree in health science or PA studies. So what are potential prerequisites of certain PA programs? So we have well, of course, you need experience. Um, you just, it, being smart with the books isn't enough. You need experience. You need letters of recommendation. You need scores. You need to take the graduate record exam. You need a completed application through the CASPA. This is the Centralized Application Service for PAs. And of course, just like in college, um, just like my experience in Ateneo, you need to write an admission essay. Well, I guess this is a different kind of essay compared to applying for undergraduate, but yeah. Certain specialties, so yeah, in PE clinical rotations, we have orthopedics, the bones, pediatrics, children, psychiatry, well, the brain, studying people, primary care, um, being a general, emergency medicine, when um, time is of the essence, general surgery, um, well, literally general surgery, obstetrics and gynecology, for women's health. So what are licensing requirements? PAs must pass the PANCE. Let me tell you this. If med students in the States um, need to, well, their licensure exam is the USMLE, or the United States Medical Licensing Examination. Usually you have USMLE 1, 2, well, step 2 CK, uh, what else? Step 3. But most importantly, the USMLE step 1 is comparable with PANCE or PANS. So I guess the PANCE is um, an easier version of the USMLE, because the USMLE is recognized to be one of the most difficult uh, licensure exams in the world. So yeah. US states that allow PAs to write prescriptions require certification through the DEA, or the Drug Enforcement Administration. So yeah, pharmacy is definitely part of your nature of study in PA school. Also, you need to pass the licensing requirements like other professional courses. This is very important. And to maintain licensure, of course, um, you need to prove that you still remember your training, your education, because it will be used all the time while you work in the profession. So you complete education credits each year through attending lectures, workshops, conferences. This is the same thing for those who are working as chemical engineers. Um, you need to stay relevant. There's new technology every day. Well, maybe not every day, but uh, there are new innovations from time to time. So it's best that you stay updated in that aspect. Also, you take online courses, you give professional presentations. One teacher told me, um, making when presenting something, you have to know what you're talking about. In the professional industry, it's not wise if you can't explain it properly. Let's say your boss only gives you 5 minutes to explain everything. Well, you'd have to adjust. If you know the topic, then you would be able um, to plan what to say, what matters, what's most important, so that everything that you say fits within that time limit. So it's all about being professional in that regard. Although usually it's subjective, but yeah, I'll leave that to you. Um, Also, you read research articles in industry publications. So again, there's new technology every day. There's new research. So everyone has to stay updated, especially if you're a professional. So what are factors that determine salary? Well, location. Um, well, like what I said here, usually highest paying states are LA and Alaska. Specialty, check your three choices at page 1. Well, what's this? Yeah, these are the three choices. Also, the experience. Of course, this applies to everyone, usually, regardless of your line of work. The more experience that you have, the higher the salary. Because in the end, they're not going to actually see where you graduated from. They want to see the experience. So, yeah. Of course, if you're an employer. This one, I think I have to fact check this. I'm not sure what this means. But definitely the three are sure factors. So, how do you become a PA? These are the detailed steps as of 2022. So first, you earn a bachelor's degree in health science. So the courses that I learned here are ethics in PA practice, principles of clinical medicine, pharmacology, community and public health, and principles of medicine, well, emergency medicine, and surgery. So yeah, pharmacy is also good bachelor's degree, better clinical pharmacy. And you earn a master's degree. Apply to a training program to complete a master's degree. This is the minimum education requirement for PA school. So what you have here, classroom instruction, lab work, anatomy, pathology, and physiology. So usually the courses that I learned here are introduction to the PA profession, fundamentals of clinical medicine, pharmacotherapeutics, pathophysiology, and research methods for health professionals. By the way, I wanted to say this. One of the best PA schools in the States, I think is, if I remember right, it's Thomas Jefferson University. So this is in Philadelphia. Also, on top of that, this university is also good in terms of training med students, teaching med students. But of course, all the hard work still ought to come from you. It's still you in the very end who would help yourself on the way to success. Number 3, you train in a variety. Wait lang. Okay, we've already tackled number 2. Number 3. So you train in a variety of specialties. So this is during clinical year. So this is where you know what specialty you would want to pursue in PA school. I just translated this in English. Number 4, you pass the PA NCE. PAs must be licensed to practice in any of the 50 US states. So it's essential to pass a score of 350 or higher. And to maintain certification status, PAs must fulfill a continuing education requirement. So I'm not sure, but usually I think you take an exam, and if you pass it, then you could still continue or extend the validity of your PA license. And if you don't pass, then that's scary. I'm not sure what to say further regarding that. Okay, so these are my sources: ZipRecruiter, US News as always, and Indeed regarding regarding career advice. So that's it for this video. Thank you for watching.